We've got somebody we feel good about. Dr. David Paul is the director of brain and spine trauma and an assistant professor of neurosurgery at the University of Rochester. He completed his undergraduate studies at Hope College in Holland, Michigan, and earned his MD from the University of Rochester, and so on and so on and so on. So for him, it is brain surgery or spine surgery or back. So you name it, the brother's doing his thing. And we wanted to find out just about his medical journey, but also not only is he a physician, he is also an entrepreneur and a dad. So with all of that being said, I wanted to welcome to the program Dr. David Paul. So glad. And by the way, he's just out of the OR, y'all. So this is real deal for him. And we appreciate him giving us some time to really hear his story, a brother doing his thing, not only in the world of medicine, but also in the world of entrepreneurship, and particularly his interest in traumatic brain injuries. And guess what? It has a culturally specific impact, right? So we want to talk about that. So first of all, Dr. David Paul, welcome to the program.
Hey, thank you for having me. It's a pleasure.
Appreciate it. So let's talk about your interest in this area of medicine and your journey to it. How, when you were a young lad, where'd you grow up?
I grew up actually in Grand Rapids, Michigan. I was born in Battle Creek, but spent all of my formative years in Grand Rapids.
And so tell us about your journey to becoming a physician.
Yeah, I would say my first introduction to medicine had to do with my grandfather. He was a pastor in a small city.
Oh, you a
Michigan.
PK?
Well, PGK, I guess, pastor's grandkid.
Yes.
But my parents were involved in ministry. I married a PK.
Okay.
And, so that's just an important part of who I am. But, what's really interesting is that I would spend a lot of, weeks during the summer with my grandparents, and I tagged along, with them pretty much everywhere they went. And I tried to emulate them in my life. And oftentimes I would go with my grandfather to the hospital, and he would pray for people. He would pray for healing. And you could just see how he
part of the ministry. What is that called when you're, when someone is in that part of the church as part of the hospital ministry? There's a name for it. I can't think of it.
Yeah, I mean they have hospital chaplains. But
thank you. A simple word, chaplain. Yeah. Yes.
My grandfather wasn't on staff as a chaplain. He pastored his own church. So
right. So we just go pray for people.
Yeah, exactly. So when a member of the church was in the hospital, he'd go and pray for them. And it was just amazing to see many of the people undergo a process of healing, both physically and spiritually. And so I came to understand hospitals as a place, not where people go because they're sick or not where people go to die, but I saw a hospital as a place where people go to get healed. And that shifted my whole mentality and perspective of what healthcare was about, the influence on spirituality and healthcare, understanding the whole person and the whole, the whole being. But then, as a kid, you're looking around and you're seeing all this technology and the monitors and the EKG leads, and you just can't help but be fascinated by, all the things that you're exposed to. So that was my first introduction. I think that little, spark in the back of my mind that, hey, this might be something I'd be interested in as a career.
And it's interesting that you say a place of healing, because a lot of folks don't see that, right? They see it as they don't see it that way. But also, we also know that though science is important and medicine is important, we know that people have better outcomes if they have some sort of faith. At least that's what I believe. Can you scientifically verify that for me, my brother?
Yeah, I mean, anecdotally, I definitely can verify that. And, when I sit down and I counsel a patient on surgery, one of the check boxes I make sure is there is, do you have a community at home that's going to be able to support you and get you through this? And if they don't have that, we hit the pause button. And I say, okay, all right, hold up. Let's make sure that that's in place before we sign you up for surgery. I try to dot all the I's and cross the T's, but if there's something that we can control, that lowers your risk of having a complication or some issue with recovery. We try to cover all that.
And so you started to get interested in medicine by going to the hospital with your grandfather, praying for folks who were in the hospital. So that was your peaked interest. So then let's talk about now. When did you start to make a serious journey and commitment? Because once you do that, right, math and science.
Yeah. Yeah. I mean, I think I was blessed in that my parents encouraged me to have a broad education, not just education, but broad experiences in life. Like I played all the sports. It's different because kids now they, do year round basketball and that's
Right,
all they
right.
do. But no, like I play, basketball in the winter. I play football in the fall. I play baseball in the spring and summer. And then I was doing karate. So, and the same with my education. My parents like had me interested in all aspects of, academics. So I enjoyed math. I enjoyed reading. I enjoyed history, science. So, I think that shaped how I perceived myself growing up. So at one point as a kid, I wanted to be an engineer. There was a point in time where I wanted to be a musician. As I got older in high school, I started a marketing firm and got involved in graphic design and all these sorts of things. And I almost skipped college and was like, hey, I could, take this graphic design thing and open up my own firm and just but I realized that, if I wanted to keep as many doors open as possible, I needed to pursue higher education. And again, I always had this inkling that perhaps healthcare might be something that I could be interested in. And if I didn't go to college, I was for sure enough closing that door.
Mm-hmm.
So, I went to college, with the mindset of, all right, let me find a place that's really successful at getting people into medical school. We'll go down that route. I have tons of hobbies. I'm great at like lots of different things. And, I have other things I can fall back on. But if I'm going to go to school, I'm going to be serious about trying to hone in on something. And so that's kind of how I navigated towards, the sciences and the pre-med track.
And so you did that. You go to med school at U of R, right, where you
Yeah.
are now.
Yeah.
And how did you decide to go into? So you do your residency, and then how did you decide that you wanted to be a specialist?
Yeah, I mean, that started in undergrad. So even to get to medical school, you have to have demonstrated some, experiences, shadowing, volunteering. You have to find some way to set yourself apart. And there was a neurosurgeon in West Michigan. His name was David Lowry. So, you go to your pre-med advisor and there's a list of, all the local physicians who are friendly towards students. So it means that opportunity to shadow. And I go through the list and it says, neurosurgeon. I was like, oh, that's kind of cool. So it was one of those things. Was like, if I have an opportunity to see brain surgery, like, yeah, I'm gonna I'm gonna take up that opportunity. That's really cool. And the surgeon was operating on a patient with a disease called trigeminal neuralgia, which basically means just excruciating facial pain. That's called an artery beating on a nerve that's coming off the brainstem. The pain is so excruciating, it causes people to want to commit suicide. So, I go into the operating room. I'm shadowing this physician. He's under the microscope looking at the brainstem. You can see all the anatomy. You can see the cranial nerves coming out. You can see the trigeminal nerve. You can see the blood vessel that's coming down and beating and sort of just hammering that nerve. And when you look at that because he's under the microscope, so you can see everything on the screen. It was like one of the most beautiful things I ever seen in my entire life. And it was that light bulb moment, that aha moment. It was like, man, like this guy gets paid to help people and to look at this beautiful anatomy and to really make such an impact in people's lives. That patient woke up pain free, and after that point, it was a no brainer for me. It was like if I am blessed enough to have the opportunity to do this, man, I'm gonna go for it.
So your stint now takes you. You get your residency there, and then you did your training in Rochester as well.
Yeah, so I did medical school. I got a master's in neurobiology, anatomy, residency. I did a fellowship in neurocritical care here. I left for a year to go to the University of Pittsburgh to do further advanced training and get a fellowship in complex deformity spine and neurotrauma. And now I'm back.
And here you are, director of brain and spine trauma and assistant professor of neurosurgery at the University of Rochester. So I told you I had a backstory, right? A real
Yeah.
backstory, right? So long time, about 13, 14, 15. Yeah. This is what year is this? 2025?
Yeah.
Now, wow, 15 years ago, I'm in the church and I fall down and I realized like, wow, that doesn't feel right. So I literally call the the after hours hotline because this didn't feel right. I just felt like there was some sort of, in my mind, dystrophy. And I'm not throwing out like, what do you mean by that? But it just felt like I didn't have control or something. That was how I interpreted it. So, make a long story short, ends up that I have a nerve blockage, which is preventing me from doing tippy toes, from bending over, and all of that. Make a long story short, at first I was misdiagnosed. So I was sent to University of Rochester to deal with the misdiagnosis. And once we got into the misdiagnosis, they were like, you don't have that, but you have this, right? And so they ended up doing an L3, L4. They found that I had a, what's that called? I can't think of the name. Thank you. Thank you. Yes. Yes. Spinal stenosis, L3, L4. And what they needed to do was shave it. They were going to actually take out those two and so that the nerves can be exposed and hopefully my brain will talk to them again and help them to give me the use and activity of my limbs. And make a long story short, thank you, Strong Memorial Hospital, because Strong was where I got that treatment and it worked out great for me. And
nice.
So I had major back surgery. Yes, I did. So that's my backstory. Get it? Okay, yeah.
I get it. I get it now.
You just, one of the areas of interest that you have is you say the racial disparities in traumatic brain treatment. Talk to me about that.
Yeah. So when I was going through residency, there's a moment where you have to really kind of think about, all right, am I going through this? Am I going through the motions? Am I going through this because this is what I want to do, or somebody else led me down this path? And to make a story short, as I was sort of observing everything around me, I was noticing significant disparities, particularly when it came to elective neurosurgery. So elective means you see somebody, you work them up in the office, and then that person decides to have surgery in an elective fashion, not an emergency fashion. They come to the hospital, you operate on them, they go home. And I recognized that there were so many barriers in place to even just get in the door of a neurosurgeon's office. This and it's been studied. So it's not just like something that I observed, it's something that is nationally recognized. And as I dug deeper into it, I recognized, man, this is a problem. So take, for example, epilepsy, right? African Americans have a significantly higher rate of developing epilepsy than our white counterparts. All right. However, we are almost 2 times less likely to undergo surgical treatment for it.
And that's because we don't want to, or because we are not informed of our options, or
so the research hasn't nailed it down specifically. But the realization is that in order to make it to a neurosurgeon, first and foremost, you had to have a good primary care doctor.
Right.
Right. You had to have navigated that system. You had to have then been referred to a neurologist. A neurologist is going to then send you for advanced monitoring, right, with an EEG. And that can be something. Sometimes that can be you're admitted to the hospital, and you stay overnight with EEG leads on. There are some surgical procedures where we implant like strip electrodes and then monitor you for 2 or 3 days in the hospital. Um, you had to have been on multiple anti-seizure medications and demonstrated failure before you even make it to a point where they are referring you to the neurosurgeon for surgical treatment of your epilepsy. So think of all those barriers.
Right.
Play.
That's like
So
10 steps almost.
So people who come from a resource deprived setting, people who oftentimes look like us who have distrust of the medical system, they don't make it through all them steps.
Mm.
And so then by the time you show up in the operating room and patient after patient after patient don't look like you start to wonder, yo, what's up with this?
Right.
And I recognize that I didn't have control over all aspects of that pipeline. I'm not a primary care physician. I'm not, on the front lines of public health. I'm not a neurologist, right? I can advocate, but there are so many aspects, of that pipeline that are completely out of the control of the neurosurgeon. So no one is saying that any neurosurgeon is racist. Like that is completely not what I'm saying. But the system is set up in such a way that it makes it hard to see one of us. And
Mm.
then that's just an example from epilepsy, but then you look at spine surgery, you look at all these other aspects of these niche areas of neurosurgery, and there's this weeding out process to get to the ideal elective patient for which you're not going to have any complications. So you want to make sure, and some of this I do in clinic, right, with dotting the I's and crossing the T's. But like you want to make sure that their weight is under control, that their diabetes is under control, that they're not smoking, that they have a support system, that they have all these other things. And in trying to set the patient up for success and yourself up for success to have good outcomes, you're weeding out all these patients. And so when I spent time in the ICU, I realized that trauma is no respecter of persons. It doesn't matter if you are black, white, Latino. It doesn't matter if you're Muslim, Christian, Jew, atheist. You are equally likely to get injured in a car accident.
Mm-hmm.
You see what I'm saying?
Yeah.
Misfortune doesn't care what you look like.
No.
And so in the ICU, when I walked around and I was taking care of patients, the patient population that I took care of much more represented just what our city looks like. I took care of patients that looked like me. I took care of patients who had different beliefs than me. I took care of everybody.
Yeah.
And there was no question on whether or not are you doing the right thing for this person, right? When a patient comes in with a devastating injury and it's a question about, life or death, and the family says, I want you to try everything, that's not a question. We do everything in that moment, no matter who you are, what you look like, what the situation is. We do everything to take care of you, to save your life, to maintain the function of your limbs, so you can walk, so you can pee, so you can take care of yourself, feed yourself. And I thought that was special. And as a man of faith who progressively felt called to this profession, I realized that I wasn't called to only take care of like these super selected elective patients who are chosen to have the best outcomes. Like as a man of faith, as a Christian, it's like I'm called to take care of the least of these.
Mm.
And, it's a patient population that's hard to take care of. In that same patient population, you have a higher proportion of patients who are alcoholics, who are strung out on drugs, who are unhoused, who, uh, find their way into traumatic situations that they didn't need to find themselves.
Right,
And,
right.
and that can be a difficult patient population to take care of. And so it's like, all right, like who's going to be the person that's going to wear that hat and say, I care about these patients. And that was the moment when I made that realization that's what I'm called to do.
So how do you make that happen?
Yeah, so as a director of brain and spine trauma, I take a larger proportion of the call. I think critically about sort of how we implement sort of protocols that sort of handle how we take care of that patient population. We're starting a clinic dedicated outpatient. So once patients with traumatic brain injuries leave the hospital, who follows up with them? So it's trying to put all these pieces of the puzzle together, but generally, as a neurosurgeon, I serve as an advocate for those patients. And, I can't be on call 24/7, 365 days a year, but I can lead by example. And that's what I do.
So right from what you just said, how important is it for you to lead by example in the skin that you're in?
I think it's important. I think it's important for folks, patients who come in who look like me. I think it's a source of inspiration. It's a source of pride. At the same time, not everybody thinks like that. So I have to show up and take care of everybody, the same, no matter what. But I do think that, especially in this field where it's so underrepresented, where there's just not the numbers. I think there's like 3,000 active neurosurgeons currently practicing. And since the founding of neurosurgery, 100 years ago or whatever, there's only been about 9,000 neurosurgeons to have ever practiced neurosurgery.
Mm,
And in the full history of neurosurgery's existence, only about 250 of those have been able to call themselves Black or
mm.
African American out of 9,000.
Oh, wow.
Majority of them are currently practicing.
Mm.
So that is a shift that's happened in the last like two decades, 3 decades.
And
Um,
mhm.
so I think it's important to sort of be a shining light that this is possible. That we're capable of shining and excelling in these spaces.
And for you, as I listen to your story, it's something that you were constantly being that was constantly reinforced in your life by your support system, right?
Yeah,
Who told you and had you believe that you could be all of these things, and that when
yeah,
you decided that you could be and wanted to be a physician, and then in one of the most exclusive, if you will, or I don't want to say exclusive, but like one of the, I guess the word is exclusive, um, that you could do that, right? That was planted in you. I wanted to. I know that our time is limited, but I do have to ask you this: what do you say to the folks that don't have the same support but have the same idea and belief that they want to be able to make a difference like you?
yeah. I would say stay curious, um, ask questions. When you're curious and you ask questions, then you expose yourself to opportunities and the answers.
Mm,
I think curiosity is the most important attribute,
mm,
uh, because you have to at some point gain access to knowledge.
yeah.
And so, if you don't have the support system around you, you have to figure out how to create it.
Mm-hmm.
You got to figure out how to pull people together. Find me on social media and send me a DM. Wherever you're located in the country. Most people, it's easy to go online and figure out the email address of somebody who is in a position that you want to be in, and email them, cold call them. If it might take you 50 times and 50 different people, uh, genuinely, people who have like made it to a certain level of success are excited to share their story and to help other people. That's the experience that I've had and that I found. So I would say stay curious, and seek out resources and seek out knowledge and create that support system.
It sounds like you have to be kind of bold and kind of gritty.
Yeah. I see where
That's
you're
a
going.
segue.
Yeah.
So that's not only an attribute, that is a brand of coffee in your entrepreneurial life that you created. And I'm interested in that story because it's not only about the coffee, but you also trying to help a cause. Talk to me.
Yeah. So that started around COVID. There was, a lot of racial unrest in our country. I think I had a lot of unrest as an individual trying to understand sort of how do I make an impact on my community and the people around me. And it stemmed from a conversation where a friend came to me. He said, "Hey, I think, you might be one of the grittiest people I've ever met." He had just read Angela Duckworth's book on grit. I don't know if you've read it. It's a
No,
phenomenal.
Angela Duckworth, and the book is called what? Grit?
Grit. The book is called Grit. Yeah.
Okay.
And it details the quality of grit and examples of how it's played out in people's lives. And basically the premise of that book, it's her PhD dissertation, basically, is that the people who are most successful in life aren't the people who are most talented. They're not
Mm.
the people who are most connected. They are the people with the most grit. They're the people who, when they get knocked down, they get back up. They're the Rockies of the world,
Mm-hmm.
right? They're the people who don't know the word no, right? When they don't know how to stop. And so when a buddy had came to me, he said, "Man, I think you have these qualities. You need to read this book." And I recognize, like, wow, like I was honored that that was a quality attributed to me. But I recognize, man, there's so many people around me in my sphere of influence, my circle, that I would say are as gritty or even more grittier than I am. And how can I share their stories? And so Bold and Gritty started as a movement in a way to share these really unique stories about Black men in a way that they hadn't been shared before.
Talk to
The
me.
stories of previous generations have been told, right? Martin Luther King's story, Frederick Douglass, like all the past generations have been told. My generation's story is not out there, right? It's just not, right? And so how do we curate these stories in a way that people are interested about, that spark conversations, that changes the narrative of how we're perceived in society, and allows, and it's also like one of these things, like when I tell somebody's story, and you probably get this, right? Because you tell people stories, right? You interview people, and there is when I reach out to a guy and I say I want to share your story, and they see the final product, they see this beautiful illustration that we've done, they see the blog post, they see it all. Like I've had grown men cry.
Mm.
You have no idea how therapeutic this has been. Like how like me sharing my story inspired me, right? So not only does it just inspire the community, it inspires the guys whose stories have been told. But how this connects with coffee is that, uh, I had this whole plan of writing a coffee table book and figuring out a way to get these stories out. My wife looked at me. She said, like, you need to figure out a different way because, you're a resident at the time. You don't got time for all this. You need to figure out like a way to get the stories out now in a way that's going to spark conversations and make a difference. And, as I was mulling over that, I had this idea in my mind that I could take a package of coffee, which coffee is like the medium that like it's a universal thing. People's go to coffee shops, you have conversation, people share stories over cups of coffee. What if I could take the packaging and I could turn the packaging into an artwork that has a beautiful illustration of a Black man on there, and then we have a QR code on the package that you scan. It takes you to our website, and you read the story,
Mm.
and it's a conversation starter. Um, and that's bold and gritty.
Yes.
Yeah, and it's not in your face. It's subconscious. A lot of people love bold and gritty. One, because the coffee's great. It's phenomenally roasted coffee. Like as a neurosurgeon, I think about the details. So it's like if I'm gonna do this, I'm gonna do it legit.
And it does
Because
have an impact on your brain.
Uh, and even down to the details are very nuanced. The logo is a black man with dreads on a horse, which you don't really see in the North. Historically, we were the original cowboys.
Correct.
A black man with dreads on a horse with the fist raised,
Mm.
right? You don't notice it until you notice it.
Right, right.
That's bold and gritty.
Okay. All
And
right.
so all these intentional choices um, went into branding the product, telling the story, inspiring the community. And then when you click on that QR code, you're like, oh wow, this is what the brand is about. And
Mm.
then you want to share it. You want to gift it to somebody, and you want to perpetuate these stories, and that's been a beautiful thing for us.
So, where's the coffee? Where can you get it?
You can get it in Whole Foods in Rochester, New York. So right now we're locally in the Whole Foods here. Lori's Natural Foods. There's a coffee shop in town, New City Cafe, that often features our coffee.
There's
So
a yeah.
yeah, go ahead.
I was gonna say there's a. Go ahead. You finish and then I'll tell you something.
Yeah, no. So right now it's mostly a local presence. We
Right.
roast right here locally and kind of maintain operations here.
So you have a Whole Foods in Rochester now?
Yes, we do.
I thought I know that the Wegmans and Whole Foods was sort of like staying out of each other's way, but I guess that's over with now, right?
Yeah.
We have a coffee shop here on a Java that might be somebody you want to talk to about that. They're a new
Yeah.
coffee shop. They just opened a few months ago, literally. So
Nice.
we might want to get that brand here in the
Yeah,
queues. You know, it'd be great.
that'd be awesome.
I just think that this is a good, and I wasn't the bold and gritty connection with the individuals whose stories you told. I think that's a very powerful way, and you certainly have the right and left brain working, bro. I gotta say that. And what would you like to say to folks about how to use their right and left brains to work in their best interest, right? The left brain
Yeah.
for the creativity side. No, the right brain is the creative side, and the left brain is the more analytical side. How do we maximize, from your perspective, the use of our brain?
I mean, I think it just goes back to staying curious. I know that sounds like a cliche answer, but I
Right.
think if you're curious, it doesn't matter what side of the brain, you're gonna work through that. I think I was blessed naturally to just have examples of that in my life,
Yeah.
and I know that not everybody grows up with those kinds of experiences. My mom was one of very select few black women engineers to graduate from the University of Michigan.
Mm.
And she pivoted to a career in teaching and then became a writer. So like that's the ultimate use of both sides of the brain in my opinion. So I got it honest. But I think that for people who aren't exposed to individuals who are capable of that and don't realize that it's possible, I think this conversation might kind of spark that interest. Like, oh, like I might actually be able to do multiple things. I might be able to operate on both sides of the spectrum, both analytically and creatively.
We're only using what percentage of our brain's capacity?
Oh, I mean, very little percentage. I don't have a specific number, but it's
Not
very
so. We can do more than we think we can do, right? Well, listen, Dr. David, what would you leave us with aside from staying curious? You give me one more thing. What
yeah, I
would
mean,
you
stay
leave us with?
grounded. Yeah,
Ooh,
stay grounded.
okay.
For me, that grounding is in my faith.
Mm.
And stay true to your roots and who you are. And I was raised to be a man of faith with moral integrity and to be curious and to just go after my dreams. And so that's what I would leave with people is, stay true to who you are. When you stay true to who you are, your passions will make room for you.
You're a father and a husband as well, and I think that's also something that you should talk about and how that also impacts how you move.
Yeah, my wife is my secret power. You know, uh, she's the other face of Bold and Gritty, and for the most part runs Bold and Gritty. I'm operating all day and seeing patients in the hospital. Without her presence and her support, there would be no me. There would be no Bold and Gritty. She really is my superpower. Like, I wouldn't be able to do any of this without her partnership. And then I have two boys. I have a six-year-old son and a 5-month-old son, and they definitely keep us on our toes.
Appreciate you. Man, David, it's been a delight to talk to you. Dr. David Paul is the director of brain and spine trauma and an assistant professor of neurosurgery at the University of Rochester in Rochester, New York, just out of the OR. And we appreciate the time you spent with us. You are somebody we feel good about here on George Kilpatrick, Inspiration for the Nation. And we leave you with this idea of staying curious to use all sides of your brain. Inspiration for the Nation. Dr. Paul, thank you so much.
Thank you.